Hello folks, how you doing? Don Kelly here, physical therapist and acupuncturist, coming to you live from my car. Apologies, no, I'm not going to look into the camera for obvious reasons because I'm driving, so just bear with me there, okay? As you can see, I'm coming from the car and it's daytime. Normally it's nighttime. You see me when I come from my car, but it's bright because I'm actually going live. I'm heading into work out to my Charleville clinic, so I have a little bit of a late start today, which is good, but a late finish, which is bad, but it's all okay anyway in the end. Now, just what we're going to talk about today is work related injuries and types of injuries people get in work, and I'm going to hopefully try explain to you how you can best avoid them. Alright, so let's talk about simple back pain, okay? A lot of people who work in offices or even work in manual labour jobs, heavy lifting, a lot of grafting type of work, will suffer with lower back pain. Now, I tell everyone pain is the symptom, and there's usually an underlying cause for the pain, so this would always need to be identified. But basically, never ignore pain. You know, if the pain is persistent or constant, or if it's not going away, always get it medically checked. All right, because it's not normal to have pain, and you'd be very surprised it can be dealt with, especially back pain. Now, you see a lot of people who work in jobs where there's heavy labour, heavy lifting, manual work. A lot of these guys will suffer with the lower backs, okay? So what's very important with low back pain is don't do anything to aggravate the pain. So if you're in a job that is causing discomfort, you know, especially lifting, go get it checked out, because if you go and see your physio or your chiropractor or osteopath, whoever, or your medical doctor, they will be able to give you they'll be able to show you how to lift and how to maneuver without aggravating the pain, because there are certain ways you can lift heavy objects without putting pressure on the discs, or at least reducing the pressure on the discs and the spine and the muscles, okay? So it's very important to get educated in how to lift, especially heavy objects. I have a general rule of thumb regarding lifting. If you can't move it with your leg, you shouldn't be lifting it on your own. So no matter what job you're in. So don't be a hero, don't be trying to lift in heavy objects by yourself. Always get some help, especially if you can't move it with your leg. You know, it's too heavy to lift. So get some person to help you lift any heavy objects. Back stretching and yoga is very good for lower back pain as well. So before you go to work and after work, do stretches. You know, stretch out your back, stretch out your hip flexors and your piriformis muscle, and do those stretches before and after work, and if you can during work, okay? And that can alleviate a lot of the pain. Now, bearing in mind, particular stretches are good for particular conditions and are bad for other conditions. So again, this is why it's very important to get some advice from a professional on what stretches you should do. So for example, the stretches you would do for a bulging disc would be very different from the stretches you would do with an arthritic spine, okay? They're very different, so just be very careful in the stretches you do. And the little rule of thumb again is, if the stretch causes pain, you stop doing the stretch. There should never be pain in your stretching or your exercises, okay? So there's some little tips for lower back pain. Also, you see people who work in offices, they suffer with back pain, but they also suffer with pain in between the shoulder blades and the shoulders, and this is very common as well. So that's that right there, so bear with me now. So people who work in office and desk work, what I advise, if at all possible, stand as much as you can in work. Try avoid sitting for long periods of time. I always suggest to people, if at all possible, work standing. If you're working in an office, get a draftsman's table and put your work tools and your computer or whatever, a higher table, and work standing up, because that way when you're not sitting down for long periods of time, you're taking pressure off of your lumbar spine, and you're also taking pressure off of not only your thoracic region, but when you're standing, you take all that pressure off, you reduce it, and you reduce the hunching motion working on the computer and all that. So working standing up is by far more beneficial than working sitting down, especially for people in office jobs and desk work and like that. So avoid sitting. If you have to sit, get up on regular intervals every 20 to 30 minutes and walk around and do some upper stretches. So a lot of issues you will see with people who work in the office, besides lower back pain, is thoracic outlet syndrome, pain up in the chest, in the shoulders, and it's generally from having bad posture at the computer. So again, you know, postural awareness, good ergonomic station, a good setup in your workstation will help you do that, will help alleviate that pain, as well as doing specific stretching exercises. And again, you know, like lower back stretches, particular stretches are, you know, you don't do the same stretch for every condition, so you need to get it checked out if the pain is persistent, and get professional advice on the proper stretch and exercise you should do for shoulder pain and upper back pain if you're getting that, especially if you work in the office or a desk job or something like that. Also, what's very common is carpal tunnel syndrome, which is pain in the wrists and the hands, and people will get kind of numbness, neurological symptoms in the fingers. Okay, so again, there is stretching exercises you can do for that. You're looking at really stretching the wrist and the flexors of the arm, okay, the hand flexors. So stretch out those bad boys, and you will get plenty of relief there. Again, any neurological symptoms, any pins and needles, numbness, you should always get that medically checked as well, because it's not always the case it's coming from the carpal tunnel. It can come from the elbows, and it can come from the shoulder as well, and it can come from the neck. So there's 1, 2, 3, 4, 5, 6 areas at least where you can get neurological symptoms into the hands. So it's not always necessarily carpal tunnel syndrome, although it might present itself as that. So this is why any neurological symptoms, you should really get it medically checked out. Okay, where are we at? So carpal tunnel. Okay, you can get golfers and tennis elbow. Okay, now the name golfers and tennis elbow, you don't have to play golf and you don't have to play tennis to get this elbow pain. Okay, golfer's elbow tends to be pain on the outside of, on the inside of the elbow, and tennis elbow tends to be pain on the outside of the elbow. And again, both of those are separate conditions, although they're very similar, but they're they're different muscle tendon groups that are causing the problem. And again, a lot of computer work, a lot of working with your hands, and you know, people who work on roads using Kanko hammers, a lot of pressure, tension on the elbows can cause this type of pain as well. So again, stretch the wrist flexors, stretch the wrist extensors, and that can help alleviate elbow pain, especially the tennis and golfer's elbow. Rest as well. Okay, you need to rest it if you're playing sport and getting these pains. You need to rest it and give the body time to heal. You know, if you're going to be playing sports through this discomfort, you're going to slow down the process of it healing, especially if you're having treatment with it. All right, that's golfer's tennis elbow. And let me see, is there anything else? Okay, there's a new phenomenon. A new one is like texter's thumb. We call it texter's thumb. So a lot of people now are on the mobile phones, and kids are starting to get it, where they're doing a lot of you know, texting on the phone and stuff, and they're getting pains, especially in the thumb. Now the condition is the name is the Quavarians, okay, whereas basically the thumb extensor, the tendon of the thumb gets inflamed, and this is becoming very common as well, not just in adults but in teenagers who are on the phones a lot and doing a lot of texting. So that becomes an issue, pain in the thumb. So that's something you can avoid. So you want to be stretching your thumb out, and there's little stretching exercises you can do for that. Self massage, ice cube massage, and you know, you need to take a rest from the actual maneuver. Now you don't have to be, you know, it's not just phones that do this, okay? If you do a lot of knitting or work with intricate stuff with your hands and fingers and your thumbs, that can bring on that condition as well. But basically what I'm saying is, with any of these work related conditions, you can help alleviate them through good ergonomics, a good exercise program, awareness, not sitting for long periods of time, stretching, activity, movement. But the main thing with any pain is, do not ignore pain. Pain is not normal, and pain is the symptom. Pain isn't the disease. There's something causing the pain. So when you get to the root cause of the pain, you will get rid of the pain. Okay, remember, it's a symptom, and never ever ignore it, okay folks? So that's it, work-related injuries. I hope that helps. Any queries, please message me, give me a call. I will always get back to you. If you know anyone who has any of these conditions, just tag them or in the comment page there, and send them on this info. So look, have a great Tuesday folks, and thanks for tuning in, and I will talk to you all soon. Have a great day. God bless you all.